Hello, my name is Mary Mucko. I am a Provider Outreach and Education Specialist in the Provider Outreach and Education Unit at WPS Government Health Administrators, known as WPS-GHA. Joining me today as my co-host and as a speaker is my friend and colleague, Rachel Wood. Rachel also works in Provider Outreach and Education and is a nurse analyst. So let's begin with today's featured topic. Effective November 6, 2023, change request, or CR as we like to call them, 13389 became effective. A change request is a communication that MACs receive from CMS, and it is in that transmittal that CMS instructed all of the MACs to send a letter to eligible physicians and non-physician practitioners about Medicare-covered behavioral health service updates. Today, Rachel and I will provide a bit of background about the updates and a review of those updates that relate to behavioral health integration, psychotherapy for crisis, and opioid use disorder, or OUD treatment. During this webinar, and just as the advertisement states, Rachel and I will share behavioral health service updates that CMS wants you to know about. We plan to provide more education on these topics in the future. We will use various ways to make this education happen, including news items, YouTube videos, website resources, or perhaps some webinars. The content of future education really depends on your needs. During this presentation, we will share the CMS prepared education on these topics. And if after reviewing these resources you have input or questions on these topics, we'll share a little bit later on in this presentation how you can send that input and your questions to us. We begin our webinar today, as we do all of our webinars, with this disclaimer, and we include it in our education really to inform learners that we've made every effort to ensure that the education we're providing is current and is accurate. The information, however, is subject to change. CMS publishes relevant laws, regulations, and rulings on their website, and answers to questions are based on the facts given, but CMS published information and instruction, their rules, will always prevail, and these are what determines final Medicare coverage. Just as a reminder, CMS prohibits recording of this presentation for profit-making purposes. So why is it that CMS published Change Request, or CR 13389, which instructs the MACs to provide updates about behavioral health services? It's because of a law passed by Congress. The name of the law is the Consolidated Appropriations Act, or CAA 2023, and it is in that law that language requires CMS to provide outreach to eligible providers on the three services that are listed on this slide. They are behavioral health integration, we call this BHI, psychotherapy for crisis, and opioid use disorder, or OUD treatment. In CR 13389, CMS provides business requirements for the MACs. It's not just WPS. These instructions were sent in that CR to all of the MACs. Those requirements are shown on this slide. MACs will provide education about the updates to these the behavioral health services, specifically billing requirements and patient eligibility as outlined in the law that I talked about earlier, that CAA 2023. MACs must submit reports to CMS for all of the education that we do on these topics. MACs are also required to track all provider inquiries that we receive on these topics, and this means that our customer service representatives must log and track all inquiries they receive on these three topics. In other instructions in that change request, CMS states In the October 5th, 2023 version of the CR, that MACs must send a direct mailing to all providers who are eligible to bill for these behavioral health services. And WPS completed this task on October 18, 2023, when thousands of letters were mailed to WPS eligible providers. Next, Rachel and I will talk about what CMS wants you to know about recent updates for these behavioral health services based on the provisions of the CAA 2023. The medical community now widely considers integrating behavioral health with primary care an effective strategy for improving outcomes for millions of Americans with mental or behavioral health conditions. There are two types of behavioral health integration, or BHI services, that Medicare will consider for payment. One is the Psychiatric Collaborative Care Model that we call CoCM. The other is general BHI services that use models of care other than CoCM. First, I'll talk about CoCM. This care model consists of 3 individuals who deliver the care. They are listed on this slide. You can see there it's a behavioral health care manager, a psychiatric consultant, and then the treating practitioner, who is the one that bills for the CoCM. This collaborative care enhances the primary care of the patient by adding the 2 key services that are listed here at the bottom of this slide. They are care management support for patients getting behavioral health treatment and regular psychiatric interspecialty consultation. The CPT codes 99492, 99493, and 99494 and HCPCS code G2214 are the codes used to bill for monthly services delivered using the CoCM. The other type of BHI services is general BHI services using models of care other than CoCM, and general BHI includes service elements like those listed on this slide: systemic assessment and monitoring, also care plan revision for patients whose condition isn't improving adequately, and also continuous relationship with an appointed care team member. To bill for general BHI services using models of care other than CoCM, use CPT code 99484 and HCPCS code G0323 to account for the monthly care integration. CMS makes payment for general BHI services supplied over a calendar month service period. Beginning back in 2003, general BI services can also be furnished by clinical psychologists or clinical social workers whose services are limited to the diagnosis and treatment of mental illness. Patients may be eligible for BHI services if they have one of the conditions that are listed on this slide. They would have an eligible condition that includes mental health, behavioral health, including substance use disorder, and psychiatric, any type of psychiatric condition. All of these would make that patient eligible for BHI services. And just as a reminder, BHI services may be particularly helpful for those patients who aren't improving under other models of care. Now, in the business requirements and that change request that CMS sent to the MACs, one of the requirements is that we tell you about this particular existing CMS Medicare Learning Network booklet. It tells you all about behavioral health integration services. So they've asked us to share this helpful resource with you. It helps explain both types of BHI that I talked about, those with the updates, and it provides details about care team members. It will tell you about the service components, the eligible conditions, and code descriptors. The next topic in the update that CMS wanted us to share with you is psychotherapy for crisis. And this is a policy change for behavioral health services based on the CAA 2023. CMS wants you to know about it. The service is different from psychotherapy services in that it is for patients in distress with life-threatening, complex problems. These would all require immediate attention. And providing this service can help reduce the patient's mental health crisis. The components for this service are listed at the bottom of this slide and include an urgent assessment and a history of a crisis state, also would include a mental status exam, and a disposition or what happens next for that particular patient. Only those physicians and non-physician practitioners who are specially trained to furnish services for diagnosis and treatment of mental illnesses can bill for these services. So we've listed them here on this slide. So these are eligible Medicare providers that can bill for psychotherapy for crisis. They are physicians, and that includes both MDs and DOs, clinical psychologists or CPs, clinical social workers, clinical nurse specialists, also nurse practitioners, physician's assistants, and those trained certified nurse midwives, those trained to perform these types of services. So for information about services billed incident to a physician or NPP, or for more information, CMS has a Psychotherapy for Crisis webpage available, and you can find a link for that in the description of our presentation today. At this time, I'm going to turn things over to Rachel, and she's going to discuss the next topic.
All right.
I'm sorry, Rachel. I had a duplicate slide in here, and I do apologize. I just have a couple more things to finish up on psychotherapy for crisis.
Oh,
I
sure.
apologize
Yep,
for that. I didn't, or I neglected to move far enough along to tell you about payment for psychotherapy for crisis, and this is really what the update is. Based on the physician fee schedule allowance for those providers that are eligible to bill this service, beginning on January 1 of 2024, payment for psychotherapy for crisis is equal to 150% of the fee schedule amount for the services that are furnished in on-facility sites of service. So other than a physician's or practitioner's office, CMS is now going to allow payment for these services, and they're billed with, and I didn't include the CPT codes on this, but it's in the materials that we're providing as a resource. It's G0017 and G0018. Those are the codes that you will use beginning January 1 of 2024 for psychotherapy for crisis. If you're looking for fee schedules to determine that allowance and what that allowance would be, we do include fees and reimbursements fee schedules on our website. They are located in the fees and reimbursement guides and resources. That's where you'll find fee schedules for physicians. You'll also find for clinical social worker and for other specialty types as well. And now, Rachel, I'm going to turn things over to you. Thank you.
All righty. All right. So good afternoon. As Mary said, my name is Rachel Wood, and I am one of the nurses within the provider outreach team. So as Mary also mentioned, I'm going to be reviewing the part of the provider letter that talks about the opioid use disorder screening and treatment information. So this info that I'll go through, again, can be found in that letter sent by Medicare that we included in our course information, and this relates to the coverage of certain behavioral health services. So Medicare will pay for opioid use disorder screenings that are performed by physician and non-physician practitioners. So if your patient is diagnosed with opioid use disorder, or OUD, Medicare will also pay for certain treatment services, and I'll talk a little bit about those in our next few slides. All right, so the screening for OUD, this is something that can be done in a couple different places. I'll go through that in our next slides, but it is a requirement and a required element of Medicare's initial preventative physical exam as well as annual wellness visit. So that's just something to be aware of. And so we can go to the next slide. All right, so where can this be done? So during, as I said, during the Medicare's initial preventative physical exam, or IPPE, as well as the an annual wellness visit, screening for OUD is something providers are required to do. During office visits in physicians' offices, as well as outpatient hospital settings, that is also an appropriate place to screen people who are maybe not actively seeking their own substance use help, but maybe have some signs and symptoms or some flags. So screening in those visits as well would be something that providers might consider. So in those cases, you might want to consider as a provider offering some screening tools, brief intervention options, as well as referring the patients in question to treatment to substance abuse, treatment services. All right, so next slide. Okay, so on our slide here, we did include some information regarding billing for the opioid use disorder services. This information can be found on Medicare's website. So, pretty straightforward. It just includes the type of service, the HCPCS code and when you would use that appropriately, and then some key facts about each code. So, for example, specific information for the initial versus the subsequent billing for the subsequent annual wellness visit. Sorry about that. Didn't realize my little watchdog snuck up behind me. Moving forward, so that's billing regarding this service. This information, again, as I said, is on Medicare's website, so please take a look at that. As a reference, we also have this in our slides for you. All right, next slide. All righty, so treatment options relating to opioid use. Medicare will pay, as we said, for certain services and certain treatment options during the following. So during evaluation and management visits, maybe for medication management. We'll also cover office-based substance use disorder treatment services, as well as the opioid treatment program. So this is a more comprehensive treatment that providers can offer. And I will talk a little bit more about the opioid treatment program in the next slides. I do want to just preface and say, if this is the topic on any of these, because I know opioid use is, a topic of interest and unfortunately something that people are needing some help with. If this is a program you would like some more information on, please let us know in the survey comments, because I am just going to be providing a bit of an overview on these programs, not an in-depth look into any of them this morning. All right, next slide. All righty, so as I said, the opioid treatment program, I'll talk a little bit more about this. What these are is that they provide medications for opioid use disorder. So those could include methadone. I'm going to butcher this one. It's been a while. I used to work in mental health, but it's been a bit. Buprenorphine, as well as naltrexone for patients that are diagnosed with opioid use disorder. So these are programs that must be a little bit more specialized, and they must be certified by specific accreditation programs and approved by accrediting bodies. Again, more information on those specifics can be found on Medicare's website. If we can also, again, provide some more information in future webinars. So Part B is what will pay for these opioid use disorder treatments that are provided by OTPs. There is no copayment for services for Medicare patients, but the Part B deductible would apply. So there's just a couple things to know as an FYI, more or less. All right, next slide. Okay. All right, so just a little bit about the coverage for these. So again, these provide medication-assisted treatment, otherwise referred to as MAT, for those people diagnosed with opioid use disorder. We would pay through bundled payments, and that would be through the opioid use disorder treatment services for those with Medicare Part B. Some of the things that Medicare will cover can include the FDA-approved opioid antagonist and types of medications that would be used to counteract using opioids specifically. We would also just cover dispensing and administering those medications as applies, substance use counseling, individual and group therapy, toxicology testing, relative intake activities, as well as periodic assessments. So as you can see, those are a little bit more in depth than just screening in an office visit. That brings us to our resources and relevant information. We did include a little bit on our slide here, so please take a look at those links if you do want some more info on this topic. All right, and so at this time, I'm just going to peek over to our questions. I'm not actually seeing any at this time, but if you do think of any questions, we do have a little bit of time left in our webinar, and I have a couple more slides that I'll go through. So if you do think of anything as I talk through the rest of these slides, please send those in to us. Keep in mind we are talking just about kind of the updates and wanted to provide that education as an, as a FYI that Medicare did put out this information on the services that they provide. But again, if you do want any more in-depth, detailed education on, billing, documentation, coverage criteria, what have you, on any of these programs, please let us know in the follow-up comments. And so I will move to our next slide and just keep an eye on the chat if any questions do come in. So next slide, please. Oh, let's see. We do have one question from Nicole. Could psychotherapy crisis evaluations take place in an ER intake area? Mary, I don't know if that's something that you want to answer today or we want to follow up with.
Yeah, the psychotherapy for crisis updates that CMS wants you to know about are for certain places of service only. And I'm looking back through my notes because I believe that I may have had a typo on the slide that showed up. They're for non-facility places of service. So these are those that are going to be paid then at 150% of the fee schedule allowance. CMS has not yet sent us notification for those specific places of service. So that's one of the reasons why we are planning future education on this topic. And I know that we, WPS, are doing something very, very similar to the other MACs because this information came about quickly. We wanted to get it out there based on the direction in the CR, and that is to let you all know that CMS wants you to know about these updates. We presume that CMS will provide more information as we near the January 1 date where some of these changes are taking an effect, and we absolutely do plan on sharing that information with you as it becomes available. So that's why we're really reaching out to you today to let you know about these updates CMS wants you to know about. and to ask you for input. You are all the experts, so you can let us know what are your needs. What do you want to know? What do you want us to discuss? And do you have any questions? And so on and so forth. So we don't know specifically the place of service where the fee schedule payment will apply. That will be coming in further notification to the provider community.
So before we go to our last slide, I want to just check with Mary. Is there anything else that you want to add before we close out today?
Thanks, Rachel. I really kind of want to loop back to the psychotherapy for crisis because I do see a couple of questions that have come in regarding the fee schedule change. And I'm looking at the information that CMS has provided, and you may not have all printed this off before the presentation because you learned about it as we were talking about it today. You learned about that letter. You learned why we're talking about this today and what it is that we need from you for future education. But CMS has, in that letter that we sent out to eligible providers, and I realize that some of you work in large offices, if there was more than one eligible provider within an office or group, only one letter was sent. So chances are that not everybody may have yet seen that letter. But in the letter it says psychotherapy for crisis equal to 150% of the fee schedule amount for services furnished in non-facility sites of service. So non-facility sites of service would be key here. Other than a physician or practitioner's office will be effective January 1, where they're going to pay that 150% versus the 100%. So 50% more is going to be paid in non-facility sites of service other than a physician or practitioner's office. And this is what I was talking about earlier. I believe on my slide, and I apologize for this, it wasn't caught through our review and approval process. I believe when I was speaking to you earlier, I saw up on the slide it said in on-facility sites of service. It should say non-facility sites of service, where you're going to get that additional 50% fee schedule allowance. So CMS hasn't provided us a list of those places of service or sites of service in any of the education they provided, but if we, we're hoping that we receive that from them, or we will go to our systems folks and just ask them for a list so that we can provide it in future education. I think that would be very valuable for those of you that perform and bill for these services. So as of right now, non-facility sites of service other than a physician or practitioner's office. So back to you, Rachel, if you have anything else to add.
No, I do not. We can close it out, and I'm not seeing any more questions that are coming into the chat. So that will wrap up our webinar this afternoon. Thank you all for joining us. We'll give you back a couple minutes of your afternoon today. So again, please sign up for any future events. We have a lot of good stuff out there on our learning or live events page, I should say. We look forward to reading your survey comments and hope you have a wonderful rest of your afternoon. You may now disconnect.